All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So the discussion today is about the shingles vaccine, not varicella zoster's vaccine or chickenpox vaccine, but shingles vaccine. So let's start our discussion. So these are gifts for humanity, and they're continuing. Quick look at the references. So this is drbeen.com, and there is a link in the description of this video that gives you access to drbeen.com at a very low price. And I've been saying it since January. I'll say it again. It is going to retire these prices. Our courses page is almost done, and then it would be for every video. However, in the meantime, check this out. If you go to video library, and then just under the video, we just added this today. You have Chat GPT connected to the videos now. What I'm trying to do is that as you study, you could ask questions from Chat GPT for the topic that you're studying. However, we haven't yet restricted it to that topic. Neither have we restricted it to logged in or not, or bot or not. So anyone can go and try it out. For example, you can say, tell me about Dr. Bean, and then it will give you some answer. I hope it does provide a good answer. So it Dr. Syed Ali is the founder of Dr. Bean, which is the wrong name here. A medical education platform that offers lectures and tutorials on various medical topics. So as you can see, it talks, but as you can see, it can make up stuff as well. So ChatGPT will be connected in 3 places on Dr. Bean. One is under the videos, second is on the homepage, and the third one is ChatGPT co-authored content. So just wanted you to be aware that this is also starting. Now for the references. Shingrix, this is the official website of the Shingrix, the CDC's recommendations, who to vaccinate, and then vaccine efficacy. This is a study about Shingrix. So we're going to talk about Shingrix and not about the Zostax. Zostax is a inactivated attenuated vaccine, and it was discontinued in the US. It was approved by FDA for shingles. However, it was discontinued in November of 2020. Zostax is actually nothing but thrice the dose or a larger dose of varicella vaccine. So the chickenpox vaccine, which is for the prevention of the chickenpox, the same vaccine given in larger dose was supposed to be for shingles. However, it is now it was approved but discontinued, and nowadays the recommended vaccine is Shingrix, and that is the vaccine we're going to talk about. So here is a study about it. This is actually a beautiful short article by University of Minnesota about this. And then, as you can tell, I have a bunch of references here. So with these, I'm actually going to stop these references, just close this so that it doesn't take too much of my memory space of the computer. All right, so back to the gifts of humanity. Let's start. So shingles vaccine, Shingrix, it is so we're going to talk about the mechanism of action, indications, and side effect. Indications mean who should take it. So it's a varicella zoster virus, or VZV. The VZV virus is actually a type of herpesvirus, and herpesviruses are divided into alpha, beta, gamma herpesviruses. The varicella zoster virus is alpha herpesvirus. Now, there are many kinds of alpha herpesviruses. Now, varicella zoster has many glycoproteins on its surface. So if you see here, this is the membrane. We have seen those kind of membranes with other viruses as well. On the membrane, there are many glycoproteins. Glycoproteins are glucose or glucose molecules with protein molecules or amino acids. So these are multiple kinds of glycoproteins. The glycoprotein that we are interested in today is called glycoprotein E, or GE. Now, inside the virus, there is a tegument, then there is a small capsid. This happens in almost all viruses, that there is something around the genetic material to kind of protect the genetic material. So, here around the DNA, it's a DNA virus, there is a core or a capsule like structure which is called capsid. And of course, outside here, this is the envelope that we have discussed many times. Enveloped viruses are, they get the envelope as they are exiting our cell, or as they are formed within the cell. They can steal that envelope from the vesicles of our cell or from the membrane of our cell. Because of that, envelopes are actually made up of two layers. They are bilayered structures because they are actually stolen from our cells, and our cells have bilayered structures or membranes. Now, here, if you see, this is a GE, the blue one is a GE glycoprotein. Usually, this glycoprotein, just like in the coronaviruses, we talked about this spike protein. Usually, the glycoprotein does not live alone. Instead, it binds or it co-locates with another protein called glycoprotein I. So, this dimeric behavior is seen on the viruses. And this glycoprotein GE has three parts. Why am I stressing about the GE? Because that is the protein against which the vaccine will be formed. So the GE protein or glycoprotein has three parts. One is outside of the cell or the outside of the virus. It is called extracellular domain. Then through the membrane, there is a part that passes through the membrane. That is, of course, transmembrane domain, passes through the membrane. And then there is a part that is inside the cytoplasm or inside the virus, and that is cytoplasmic domain. So these are the three domains of this glycoprotein. Now, diseases, just generally, this is not a lecture about the diseases by the virus, but instead the mechanism of action of the vaccine and how does the side effects and the safety profile and the indications. Diseases by the varicella zoster virus. Chickenpox is the primary infection. That means if somebody has never been exposed to the varicella zoster virus and the very first time it infects them, then that will be chickenpox. And it's not necessary that all chickenpoxes are the same blisters everywhere. It starts with the rash and then it can become blisters and then they crust over. But sometimes there are lesser number of blisters, sometimes there are more blisters. So it would be different for every child, but there is a general appearance. Now, please keep in mind that 1/3 of the patients who develop chickenpox are at a risk of developing shingles later in life. Now, also please remember, shingles is not the primary disease of varicella zoster, meaning the virus cannot arrive in a person's body for the very first time and cause shingles. The very first time it normally causes chickenpox. Then, as it infects various parts of the skin, it will be picked up in the nerves and it would travel through the nerves. We call it retrograde travel, that is backward travel. And it goes all the way to the ganglions, and I'll discuss them a little more later on. And it starts living in the ganglions, dormant, silent, quiet, forever. Now, as we reach 50 years of age and above, or if for any reason our immune system becomes weak for some time, either because of immunosuppressants or because of immunocompromised, some disease, or just temporary immunocompromise because of other diseases, then the reactivation can occur. So this is why most of the time shingles occur 50 plus. Excuse me. However, it can occur in immunocompromised who are younger or anyone whose immune system is in stress. Now, please keep in mind that by age 85, I wrote 85%. By age 85, approximately 50% of the population of 85 years and older will have developed shingles. So in the younger age, 50 plus, 1 in 4 or 1 in 3 will develop shingles. But 85 plus, 50% will develop shingles. There was a Swedish study by Nilsson et al. They said the incidence of shingles is 315 cases per 100,000 for all ages. However, it is 577 cases per 100,000 for 50 plus. There was another report for Switzerland and Sweden where they said that CNS can be involved, the central nervous system, the brain and the cranial nerves can be involved. And that is 1.02 cases per 100,000 in Switzerland and 1.8 per 100,000 in Sweden. Lesser than shingles. Now, shingles is usually unilateral, meaning on one side of the body, usually sensory nerves. And wherever these sensory nerves are supplying, so of course, our whole body is supplied by the sensory nerve. Wherever you touch and you can feel the touch, there is a sensory nerve there. That is why you feel the touch. So the sensory nerves supply area, one nerve or another couple of nerves near it, that supply area, the dermatome of that sensory nerve, usually the blisters appear there because the virus descends in the nerve from the dorsal root ganglion and then infects that area. So if you see here, I have a small segment of the spinal cord. From this spinal cord on the front, or as we say ventral side, motor nerves come out. On the back or the dorsal side, the sensory nerve from the skin, they go all the way and enter the spinal cord. These nerves, the sensory nerves, have their cell body because these are neurons, right? So neurons have dendrites and axons. So the neuron itself, the cell body, makes a tiny swelling, lives outside of the spinal cord, and this tiny swelling or the presence or collection of sensory nerve cell bodies before the spinal cord is called sensory ganglion. Ganglion is nothing but collection of neuron cell bodies. Sensory ganglion or dorsal root ganglion. Why? Because there is a dorsal root of the nerve and there is a ventral root of the nerve. These two roots, they combine together to make one nerve. The point is, when in the early life chickenpox occurs, the virus would just travel and go and live in the sensory nerve dorsal root ganglion and just live there forever. Then if at some point we become weak for our immune system, or as we age and our memory cells start withering away, start going away, our general number of cells, immune cells reduce, their efficiency reduce, then the virus can find its way back to the skin and cause shingles. Now, the virus can live in dorsal root ganglion. That is what I just explained. It can also live in the autonomic ganglion. Autonomic ganglions are also another chain of ganglions on the side of the spinal cord in the cervical and thoracic and abdominal region, mostly cervical and thoracic region. And they control they have the nerve cell bodies for the autonomic system. And the virus can sit there as well and cause autonomic dysfunctions too. And finally, cranial nerves, for example, facial nerves or trigeminal nerves or other cranial nerves, ganglion can also have the virus. And that because of that, shingles can appear in the face and cervical areas as well. The pain because of shingles is often characterized as burning pain, but it can be, the paresthesia can be of many types. Sometimes just the rubbing of the clothes or just touching that area can cause a lot of pain and discomfort. usually it is on the same one side. Now, this pain generally in most people would go away in a few weeks. The neuralgia or the discomfort, the blisters would go away, the rashes and the blisters on the skin will go away. Then neuralgia would still be there, and then that would go away as well. However, in 10 to 15% of the people, the neuralgia stays more than 3 months, and that is a chronic disabling neuralgia. It is called post-herpetic neuralgia, and that usually is more than 3 months. I have seen patients where this chronic state is even longer and easily triggered and is very, very discomforting. It is in some patients that have spoken with me, it is even to a point where they become suicidal because of the discomfort. Now, Shingrix, the vaccine, the whole discussion before this was to bring us to the point of discussing this vaccine. So, Shingrix is by, I believe, GlaxoSmithKline. The Zostavax, I believe, is by Merck. So, it's a recombinant adjuvanted vaccine, meaning what they do is, if you see here on the left side, they take the glycoprotein E from the virus. They take the DNA of that and they give it to bacteria, and the bacteria then manufacture those, just like Johnson & Johnson vaccine or Novavax vaccine. So the bacteria would then make this protein, GE protein. Then, so if imagine if this blue one is the GE protein, then they combine it with an adjuvant that is going to be irritant for our immune system and kind of a trigger for the immune system. That adjuvant is called AS01B. So this vaccine, Shingrix, is actually a combination of GE plus AS01B. One dose contains 2 milliliter intramuscular. There are usually two doses within 2 to 6 months apart. Although varicella zoster vaccine can be given, so remember that is live attenuated virus vaccine. Shingrix is not live virus vaccine. It is a subprotein vaccine. So I'm talking about the varicella zoster vaccine for chickenpox. That vaccine, normally the first dose is 12 to 15 months. The second dose, the shortest time between first to two is 3 months, but normally 4 to 5 years of age. The efficacy, this is a very interesting thing. The efficacy of Shingrix for shingles is greater than 90% for all ages. So 50 to above, greater than 90%. For example, 85 years had 91% efficacy, and 50 plus below 85 had 97% efficacy. But still, that all was greater than 90%. That actually, no other shingles vaccine offers this level of efficacy. Now, the duration of protection in the studies seems to be 4 years, up to 4 years. Although the experts and the doctors who have been running these studies, they think it should be more, but within the trials duration and follow-ups, they proved it for up to 4 years. Now, I also want to talk about efficacy a little more. In the references, I have a reference to University of Minnesota's article. In there, they talk about, so this is an excerpt from there, 50 to 70 years of age, 97 and 91% efficacy. Compare that to Zostavax, which is live attenuated virus vaccine, although discontinued in the US from November 2020. Look at the efficacy, 70%, 64%, 41%, and 18%. In the patients 50 to 59, 60 to 69, 70 to 79, and 8-year older. So 8-year older, only 18%. On the other hand, Shingrix, doesn't matter, 80 years or older, that was also 91%. So that's a huge difference in the efficacy. Additionally, patients 70 years of age or older who previously had herpes zoster, shingles, and then received the recombinant zoster vaccine, so had shingles, then got the vaccine as well, had an approximately 89% reduction in post-herpetic neuralgia. So the most scary thing is post-herpetic neuralgia, at least from a patient's point of view, because that discomfort is a lot and it is kind of chronic. So 89% reduction in post-herpetic neuralgia, even for those who had shingles. So that's very, very important. So the duration of efficacy, as I said, approximately 85 to 93% after 4 years. This vaccine is not intended as a treatment for the primary vaccine. So I discussed that. The primary prevention for chickenpox is varicella vaccine, not Shingrix. Now, I think you would love this. The cool beans here, we love the mechanisms. So I think you would love this. Imagine that this is a macrophage. Macrophage or a dendritic cell, something that is exposed to the vaccine or the antigen. We have been talking about it for a long time. And we know that the macrophage will pick it up, the vaccine, and then break it down and then present it to T helper 0 cells, cytotoxic T cells. No, not cytotoxic, naive helper T cells. Now, in the presence of interleukin 4 and absence of interleukin 12, the T helper 0 cell will become T helper 2 cell. T helper 2 cell then would release interleukin 4, 5, 10, 13, but especially 4 and 5 are going to help the B cells to transform, convert, or differentiate, as we say, from naive B cell to plasma cells. Or plasma cells are, as I call them, pregnant cells. They have a tiny belly that develops where they have started making antibodies, and they would release those antibodies in the circulation, in the local tissues and circulation. So this is called the humoral response. Now, this vaccine does produce humoral response. However, this vaccine also produces the cytotoxic response. So what is that? When the macrophage presents to T helper 0, naive T cell, then in the presence of interleukin 12, and 18 as well, but mostly interleukin 12, T helper 0 becomes T helper 1. T helper 1 then releases interleukin 2, which then causes cytotoxic T cell or CD8 positive T cells to become differentiated and activated. These now become active cytotoxic T cell. That means when they would see in the future any varicella zoster virus coming in, becoming active, or presented on a cell, they would kill that cell. They are cytotoxic. So the cytotoxic response is actually also activated. So both responses. Interestingly, the cytotoxic response is 25 times more than the humoral response, which is excellent, because now these cytotoxic cells would just go around the whole body, and wherever there is a cell that is infected by the varicella zoster and is presenting it, they would kill it. Now, this 25 times more effect is 12 times more effective from Zoostvax, so the other live attenuated vaccines. So the subprotein vaccine for the cytotoxic response is 12 times more effective compared to live attenuated vaccines. Now, a few things that I wanted to just take directly from the site, the Shingrix site, to share with you the side effects. So here are the side effects. So if you see here, solicited local adverse reactions and general adverse reactions within 7 days of the vaccination. In Shingrix placebo, so if you see here, 88/10, 14/1. Redness, 39/3, 1/10, and you can keep going. Similarly, if age is 60 to 69, pain 83/7, 11/1, and as you can see the rest. Here, age 70 plus, Shingrix percentage N equals 2 to 58, 69/4, here 9 divided by 0.2. The more systematic effects or general reactions: myalgia. Myalgia is muscle pains, fatigue, tiredness, headache, shivering, fever, and GIT upset. That's about it. And the rates observed with Shingrix versus placebo. Serious adverse events 10.1%, placebo 10.4%. So equal. Deaths 0.8% in Shingrix, 0.9% in placebo. And then potential immune mediated diseases, autoimmune diseases, 0.6% and 0.7%. That's a beautiful study result. Now, who should take it? Indications. So, as I said, it is not a vaccine for chickenpox. It is a vaccine for shingles for someone who have had chickenpox. So, is a vaccine indicated for prevention of herpes zoster shingles, adults age 50 years and older, in adults age 18 years and older who are or will be at an increased risk of herpes zoster due to immunodeficiency or immunosuppression caused by known disease or therapy. For example, somebody is going to go through chemotherapy. Shingrix is not indicated for prevention of the primary disease. Now, safety information. Contraindicated in anyone with a history of allergies, anaphylaxis. Then review immunization history for possible vaccine sensitivity and previous vaccine related adverse reactions. Appropriate medical treatment and supervision must be available while administering Shingrix. In a post-marketing observation study, an increased risk of Guillain-Barré syndrome was observed during the 42 days following vaccination with Shingrix, GBS. Syncope, fainting can be associated with the administration of injectable vaccine, including Shingrix. Procedure should be in place to avoid falling and injury and restore cerebral perfusion. Solicited local adverse reactions reported in individuals aged 50 years and older were pain 78%, redness 38%, and swelling 26%. General reactions 50 years and over: myalgia, muscle pains 45%, fatigue 45%, almost half people, headache almost one third, 38%, shivering 27%, fever 21%, GI upset 17%. And solicited local adverse reactions aged 18 to 49 and 50 plus were pain 88 to 83, redness, swelling. General reactions, once again, fatigue, myalgia, headache, GIT symptoms, shivering, and fever. The data are insufficient to establish if there is vaccine associated risk with Shingrix in pregnant women. It is not known whether Shingrix is excreted in human milk. Data are not available to assess the effects of Shingrix on the breastfed infant or on milk production excretion. Vaccination with Shingrix may not result in protection of all vaccine recipients. It's 90% effective, so that means some people would still get it. Now, in UK, there is another vaccine for chickenpox called Verilix. So we have Zoostvax, Verilix, this Shingrix, however, and vericella vaccine. And as I discussed these before as well, this is the discussion. I see a comment here, and it doesn't prevent infection. The role of Shingrix is to prevent shingles or to help protect from shingles, and the efficacy is 90%. Correct. So this is the discussion. Thank you for listening in. If you like, I can talk about varicella zoster and the chickenpox vaccines as well separately. Varicella zoster vaccine or the chickenpox vaccine, and we can talk about chickenpox as well. So with this, thank you very much. Please like, subscribe, and share. If you would like to support this work, you have links in the description. You can buy me a coffee, or you can use PayPal, or you can become a member of Substack, or you can become a member of Patreon. So with this, thank you very much. Have a good day, and I'll see you tomorrow. Bye bye for now.